Welcome, everyone, to Session 9 of Nursing on the Front Lines of the Clinical Crisis, Education for Action. Session 9 will focus on climate change, mitigation, adaptation, and resilience. These are our course partners. And again, we're in Session 9. Today's November 26th. We have one more session, and we're very happy that all of you have come along with this for all the sessions. Our session today is on climate change mitigation, adaptation, and resilience. For attendance confirmation for all participants will be provided for both live and asynchronous participation. For live attendance, individual attendance is automatically recorded during the live Zoom sessions and video recording views. Your attendance is not counted if you join with a colleague's link. For asynchronous attendance, video recordings of previous sessions are available on the Alliance of Nurses for Healthy Environments platform. For continuing education credit, these are for the United States-based participants. In order to receive continuing education, which is 1 CE available per individual webinar, participants must have attended the live webinar session or view the recording and receive at least 80% on the post-session evaluation. Following the webinar, attendees will be directed to the Alliance of Nurses for Healthy Environments Learning platform to access the webinar recording and post-session evaluations. Participants who attended the live webinar session on Zoom will be provided a password which allows them to bypass the video viewing requirement. These are the dates the password codes have been sent out previously. Most recently, the code for Session 9 to take the post-test questions and do the evaluation was sent out on November 21st. Participation is counted for all with a certificate. So participants who attended at least 7 out of 10 live Zoom sessions or view the recordings and pass the course final exam with a score of 70% or higher, you will be awarded a certificate of participation. Certificates will be issued on December 17th from the consortium. The final exam, this is the information on the final exam. For the format will be 20 multiple choice questions with true and false questions as well. The exam link will be sent with the final video recording via email and on WhatsApp. The exam will open on Thursday, December 5th at noon at 12 o'clock Eastern Time and close on December 10th at 11:59 p.m. Eastern Time. That's in New York City. Participants must take the exam in one sitting. Note again that it is mandatory to join the Zoom classes, watch the video recordings, and take the final exam under the same email address. Now I'd like to introduce our speaker today is Dr. Heather Baid. Dr. Heather Baid began teaching as a visiting lecturer at the University of Brighton in England in 2003, while still working clinically as a critical care nurse. In 2007, Dr. Baid took on a permanent teaching position at the University of Brighton in England to lead the intensive care modules on the continuing professional education program, which she has continued to do ever since. She received her Master's of Clinical Studies in Education in 2010, a postgraduate certificate in research methodology in 2013, and her PhD in 2018. Dr. Heather Baid has twice received the Excellence in Facilitating and Empowering Learning Award at the University of Brighton. In 2020, she achieved the University of Brighton's Rising Star Research Award. Dr. Baid is a member of the British Association of Critical Care Nurses, and her primary research interest is in the sustainability healthcare practices. And one of her current research projects is she's working on environmentally sustainable healthcare practices in the intensive care unit. Please join me in welcoming Dr. Heather Baid.
Thank you very much, Karen. And I'm just going to share my slides. So can I first do an audio sound check? Can you all hear me?
Yes.
And can you now see my slides as a full?
Yes. Go right ahead.
Fantastic. Great. Thank you very much for this opportunity to speak today. And how fantastic is this course, and just the momentum of nurses working in this space around planetary health has just been really inspiring. And I feel really privileged to have the opportunity to speak to you all today. And I've been asked to speak on climate change mitigation, adaptation, and resilience, drawing from my experiences here in England. I am originally from Canada, and so people from Canada on the call. It's where I began my nursing career, did my education in Vancouver as well. But I've been working in England for some time, but also been really looking forward to hearing from all of you and sharing practices around how people are addressing these issues around mitigation, adaptation, and resilience in your own nursing practice globally. So it's fantastic to be able to learn from each other and use this course as an opportunity to share ideas and come together. Can I just make sure that you can see the full screen as well? Is that okay? Okay. So the objectives for today are to define and distinguish between climate mitigation, adaptation, and resilience, apply the concepts of mitigation and adaptation to the healthcare sector, and explore examples of how healthcare systems can perform both of these things. And then really looking at the nursing sector around what nursing professionals can do in terms of partnership with nurse educators, professional organizations, and advocacy groups to reduce healthcare sector's greenhouse gas footprint. And I understand there's both a combination of nurses and students here today, and perhaps people from other disciplines as well. So much about sustainability really is multidisciplinary, even if we are focusing on nursing today, lots of links with other disciplines. And I was really pleased when Gina said that there was nursing students joining us today as well, because that's the future. And, you know, this is really about future-proofing the present as much as the long-term future. And I've got some recommendations for students and educators in the slides today. I have shared these slides, so they will be going on or already on the resources, and all of the references and resources are hyperlinked if you wanted to follow up on anything afterwards. So what are these concepts of mitigation, adaptation, and resilience? In some of the earlier sessions, actually, these concepts have already been described, so you might have already been familiar with that from earlier speakers in this series. But just as a reminder, or if this is new to you, mitigation really is what we do as nurses to reduce our carbon footprint and other aspects of planetary health damage that we do just by going to work and doing our jobs and looking at, you know, what actions can we do to prevent or reduce greenhouse gas emissions. Adaptation is recognizing the fact that we're not going to mitigate our way out of this crisis. We're in too far. And, you know, it's quite timely with this session coming off the back of COP just finishing and, you know, where we are globally with, you know, trying to reach that 1.5 degree limit that everybody's trying to reach. But actually, we're living in a day-to-day crisis already. This isn't a crisis for the future. This is a crisis right now. Certainly in the UK this week, I don't know if anybody's here from England, and across the UK, the floods that are happening, heat waves, droughts around the world, you know, it's too late to say that we're going to solve the problem simply through mitigation. So we're really looking at adaptation. And adaptation is about adjusting so that our healthcare systems are adapting to this climate crisis, because the impact of climate change on energy supplies, on resources, on our supply chains, on our ability to do our jobs as nurses is quite impactful. And there's an overlapping concept with resilience around the ability to anticipate and prepare for and recover from the effects of climate change. So I'm going to combine adaptation and resilience as one theme today, but also there's a sort of Venn diagram where it overlaps with mitigation, because sometimes some things that help with mitigation also help with adaptation and resilience. And if you've been following this series, you'll have seen this model already from previous speakers, the reference there if you wanted to read up more about this model, but really looking at that kind of systems theory around, you know, the patient or client or person in your nursing care that you're caring for, that sits within a family structure, that sits within the community, that sits within the perhaps even other systems within that, healthcare systems and region, international planetary health, and they all interrelate. So environmental influence and factors at an individual level are going to ripple up and build up to all the way to planetary health level. But at the planetary health level, it also, you know, these sort of wider global problems impact on all of the microsystems within that, with influences politically, socially, environmentally, culturally, and economically. And I wrote an article about this with an intensive care doctor a few years ago, and this was a diagram from that particular article where we were really reflecting on this sort of interplay between all those different systems. And I know that this particular program is focusing on climate change, but climate change does sit within the wider context of other planetary health problems that are interrelated in relation to biodiversity loss and pollution, etc., and very much influenced by and causing social justice issues, whether that's war and civil conflict, poverty, mass migration, inequality, modern slavery, etc. And the accumulation of these really complex global problems around planetary health and social health, ultimately affecting people's health, and the public health issues that are a result of the planetary health problems that we've been hearing about in the other sessions on this series. All of that makes people sicker, and they need healthcare, and they need more nursing care. And then that nursing care has an environmental footprint, which then causes more planetary and social health problems, etc. So we're in this really vicious cycle of, it's a little bit like, I was teaching compensation mechanisms the other day with shock and things, and we were talking about how the body's compensation mechanisms, there's a feedback loop that sometimes the compensation starts causing other problems and things. And it reminds me of that, this sort of one thing that, you know, has an effect for one thing ultimately ends up influencing farther back in these feedback loops. And how do we break this kind of negative, damaging cycle to nurse in a way that's not damaging to the earth, as well as how do we prepare for and adapt to the planetary health damage that is there already. And so mitigation actions can also help us with adaptation actions. And certainly some countries and some healthcare systems are having plans in place at a national level, as well as regional and local level. And in England, we've been lucky to have a national strategy on this for a few years now. In fact, England was the first country to have a national health service strategy. Other countries are now thankfully following suit. And we also have adaptation plans, and I have some of those references just to give a bit of context that health in the United Kingdom is delivered, and the political structures around that are different between England, Scotland, Wales, and Northern Ireland, which is why I sometimes have English and Scottish references, but all under the United Kingdom umbrella. For resources on adaptation for climate-resistant healthcare, I'd really recommend the World Health Organization resources that are there. There's a checklist to assess for vulnerability, so that helps you to assess your own healthcare system and how that translates down to your nursing practice. And this guidance document around building both climate resistant as well as environmental sustainable healthcare facilities. So that includes mitigation as well. And the diagrams that are then coming up in the next several slides come from that second reference. And I really like this one because I think in a nice visual way, I don't know about you, but I like a nice colorful diagram. It takes these really big, you know, complicated things and starts to simplify it down and says, okay, well, what does this mean for me as a nurse? Or maybe if I'm a nursing student and I'm looking at, you know, working on an assignment for my nursing course and trying to think, well, how does this particular assignment have, what are the implications for climate change and healthcare facilities, et cetera, and things. So, you know, obviously further explanation of the diagrams in the World Health Organization document, but it really gives a nice visualization around some of the themes that can help to be more positive, forward thinking in developing the building blocks that we need to build a climate resilient healthcare service. That includes leadership, the workforce, health information systems, medical products and technologies, how we deliver that service and the process around that, and obviously financing is important. And then we need the people to be able to do that. So, you know, the second circle around the healthcare workforce, as well as energy, infrastructure, and water, sanitation, hygiene, etc. And this diagram looks a little bit busy, but it's not as complicated as it looks at first glance, I think. And if you just sort of follow it through, it's sort of that idea of that, you know, there's going to be stress. A little bit like as people, we have stress, and that's okay. We've got stress response systems, and it'd be a bit boring if there was no stress at all. So stress is okay. There's nothing wrong with having a bit of a shock and stress. The problem is if you're not ready to manage that stress. And so looking at risk, What are the risks? And locally, that's going to be different. For example, at the moment in England, flooding is a major issue. It might be droughts in your country. It might be energy. It might be a combination of things. But looking at, what would happen if there was a major planetary health issue? What are the risks? How are we going to respond? And what do we need to do to recover in order to get back up to that normal state of a healthy healthcare system? And looking at things like waste, chemicals, radioactive materials, pollution, etc. As a nurse, it may feel like a lot of that is a little bit disconnected from you, but whether you're working in community settings, GP surgeries, hospitals, public health, nursing, such a rich profession of so many different roles. There's such an interlink between whatever the facilities are and the estates or the departments or the people involved in managing facilities and the day-to-day work of clinicians. And what I find in my sustainability work, the most successful sustainability projects, whether it's adaptation or environmental sustainability that I've observed or been part of, is when you make those links and you pick up the phone and you find out, people in estates or in procurement and who's in charge of energy. And they are desperate to talk to clinicians to know about how their jobs relate to what we do as nurses. And looking at ultimately the risk reduction that we can try to achieve together to have more resilient facilities so that we can be prepared for what would happen if, all of the energy went out. What would happen if we ran out of batteries? What would happen if we can't get supply chains in due to planetary health damage? I don't know in the chat if anybody wants to share. I was curious if anybody's affected by the current IV fluid shortage that's happening globally, because many healthcare systems rely on the company Baxter's IV fluids, and one of their manufacturing sites somewhere in the States was hit by Hurricane. Is it Helene? Which I say that. And I don't know if other people have had those same issues and things. I'm looking at, it's a climate problem, but actually that's impacting on our ability to be able to deliver a service. And looking at vulnerability, or another example I could give on that is several years ago there was an earthquake in Italy, and we didn't realize that the entire country of England's fluid replacement for the kind of renal replacement therapy that we use in intensive care unit relied on that one factory in Italy, and it was destroyed by an earthquake, and we were suddenly rationing fluids because that one place was the sole source. So I think the pandemics have brought all of us globally, really good life lessons around what happens if stuff just isn't there one day, and that's becoming the reality due to these ongoing planetary health issues. So whether it's floods, droughts, fires, we've heard a lot of those types of topics over the last few years. They impact on public health, but they also impact on the healthcare facilities. And, I've already mentioned those sort of themes around workforce, water, sanitation, etc. And really looking at what's our role as nurses, because depending on your nursing role, it might either impact on your role, or it might be that you're quite influential in facilitating a plan and implementation to become a more climate resilient system. And looking at, establishing a team, establishing baselines, looking at interventions, goals, and monitoring so that we're prepared. So you're not in the middle of an emergency with the beginning of thinking about, where do we go with becoming climate resilient as a healthcare service, and what's our role as nurses within that. If you're not familiar with the Centre for Sustainable Healthcare, they're an organization based in England, although they do seem to work with people in other countries these days. And they've got a nursing network that you can join for free, but they've also got a variety of different references that I'll be referring to today. And one of them is a really nice overview of adaptation to climate resilient healthcare, looking at identifying monitoring risks, building resilience to service disruption, and preparing the health workforce to respond to climate health impacts so that we can prepare for heat, cold, floods, storms, but also practical things like I've already mentioned: electricity, batteries, water, food, gas supply. Just to share some local although at national level. Examples from my neck of the woods here in England, we do have an adaptation report for NHS England with strategies, and Scotland also has an equivalent now. So if that's of interest, if you're looking for examples in other countries in terms of adaptation, that might be some references that are useful for you. And I'm going to spend the rest of the time now talking about mitigation, which is a little bit more of my expertise and where I'm focused more on my current research at the moment. And when I think about sustainability, I always try to think about quality as the main driver, because I think in any sustainability project, whether that's financial sustainability, environmental, like we're focused on today with climate change, sometimes the language and the terminology that's used isn't always understandable to everybody, and there can be misinterpretation, or feeling like it's cost cutting, or feeling like, oh well, we're doing this to save the planet, but that's at the cost of quality. And actually, in my experience, and when you look at the research, environmentally sustainable practice very often save money and can improve patient care. And if we're not improving patient care, we should be at least maintaining patient care. So that's why I really like this model of sustainable healthcare practice and the sort of embedding of sustainability within quality improvement projects, because the quality care is the goal. Oh, and we happen to save carbon, we happen to save some money, and we add some social value. But actually the patient and family are the center of that, and maintaining the quality care as the top priority. And that's very important, particularly if you're doing business plans and when you're looking at the politics that can influence sustainability, that nobody can argue with improving quality care. But people can say, well, we don't have the money for that, or there's political implications, particularly with some topics like PPE off the back of the pandemic. Sometimes language can be really important when you're looking at environmental sustainability projects. The other thing is, this is new. I don't know about everybody else, but when I went to nursing school, nobody talked about this. This is relatively new. Yes, we have a national strategy in England, but it came out. I always forget if it's 2020 or 2021. It's definitely during the pandemic. It was a bit of a blurred memory period. That's only a few years ago. This is such a new area. There's very little research around what is the most environmentally sustainable way. And sometimes what we think is environmentally sustainable, when you start to look at it, you think, actually, when you look at the bigger picture, one saving for carbon footprint might be at the expense of an increased carbon footprint somewhere else in the supply chain. And there's still a lot of work to be done around this. And so the language around it, the carbon literacy, and certainly these types of programs like the one offered in this series of session is fantastic to really be highlighting that this should be a really important topic that's part of all nursing programs and nursing practice. I'm sure this has been discussed already in other sessions, but there is a massive environmental footprint just from the healthcare sector. It's estimated to be around 4 to 5%, which is a small number, but if you think about that's one sector, so it's actually quite big. It comes out like a country. So if the healthcare sector was a country, it would be the 5th largest emitter of greenhouse gas emissions. And this report came from the Healthcare Without Harm organization. And if you're not familiar with carbon footprinting terminology, you might not be familiar with this phrase, life cycle assessment, but it's a style of carbon footprinting, which is quite extensive. And sometimes the phrase that's used is cradle to grave. So you look at, from the raw extraction of materials from the earth to the manufacturing and transport and use and waste management, because if we're only really looking at the use, and we think, oh yeah, we saved a little bit. A bit like your shopping bags when you go shopping. If you're using a cloth bag, you have to use it 1,000 times before it comes out that you've actually made an environmental difference. Because when you look at the bigger picture, well, where does that cotton come from if it's cotton-based? What about the water? What about the sort of transport? And with healthcare supplies, most healthcare supplies are, it's an international global supply chain. As we all realized in the pandemic, we couldn't buy stuff overnight. And when you look at the whole life cycle assessment, it's surprising where there's hidden carbon footprints that you hadn't anticipated. There's not that many life cycle assessments done within healthcare. There's other ways of doing carbon footprinting, and where you can use procurement data to have a best estimate. But the language around that is becoming more common. And there is a free database now. If you're not familiar, it's called the Healthcare LCA database. So it's open source, and you can go to the healthcarelca.com website. It's a growing resource. There's very relatively few life cycle assessments done in healthcare. But if you're looking for example, what's the carbon footprint of gloves? One glove, and then you do a waste reduction project in your local nursing practice, you can also, then say, well, if we know that the carbon footprint of one glove is, X amount, well, then you can give an environmental sustainability evaluation within that type of topic. And I've got a case study on the end talking about glove use, etc. So it's making this sort of link between environmental science and the specialist in carbon footprinting and healthcare practice, which is becoming more and more merged. So just going back to the World Health Organization, if you weren't familiar, they also have a network called Attach. If you go to the attachcommunity.com website, you might find that there's references there. It's a bit more of a global and quite strategic and policy level, but I just wanted to bring in international context because I know this is for a global nurses working group today. And they support climate resilient and sustainable health systems, bringing together the WHO member states and aligned with COP29. I don't know about anybody else, but I haven't had time to check it out yet. I keep trying to go to the website. I've been hearing about people who've just come back. So if you're familiar, I know Gina, Michelle, and others have been to previous COPs and things, or maybe somebody on the call today. It'd be great to hear from you later on in the discussion at the end. Is it right, Azerbaijan? But if you go to the website, there's the health pavilion and all the health stuff, and there's all the recordings are there. I haven't had time to watch them yet. It's it's just finished days ago, wasn't it? And I found out about this afternoon, so I've snuck it in just before I come on here, but it's not on the slide deck. But if you just Google COP29 special report, COP, for this particular COP29, you'll find it. And I like that statement that health is the argument for climate action. We're doing this for our health. We're doing it for our patients' health. We're doing it for the public health, our families, and that all intertwined with the planetary health. And I think traditionally, a lot of these high-level policy making, the discussions around all of the topics that you've had in the previous, is it 7? If this is the 8th one, or I don't know, I might have lost count there, sessions. There's a specialist in air pollution, and there's a specialist in heat, and there's a specialist in that, and actually been very disconnected from the health and the healthcare providers. I think these types of reports are, and the language around that have been really helpful. Just from a European perspective, the World Health Organization also has a World Health Europe declaration that they do every 5 years. The most recent one was in Budapest, hence it's called the Budapest Declaration. I was privileged to be invited to speak. And I have to say, I was the only nurse there, at least the nurse that I came across. I couldn't find any other nurses. We met loads of doctors. And I kept saying to people, where are the nurses? 50% of the healthcare sector are nurses. Where's the nurses in the conversation in policymaking? And people kept saying, oh, so great to have a nurse. And I said, well, have you invited any? And so this type of conference is, where ministers gather and they have invited speakers and things. So, so it's hard to be at the table if you're not invited. But I think, programs like this and this whole consortium and, all the work and the case studies and just this massive momentum that this Global Health Nurses Working Group is fantastic for getting a voice out there. And, I really learned a lot from that event around just having the opportunity to share a nursing voice and to have a nursing perspective on climate resilient healthcare systems and environmentally sustainable healthcare systems, etc. So just bringing some English context, like I said, we do have this legislated now, so this is a legal requirement. But I asked my students this the other day, very few of them know that. So it's great to have top-level policy and legislation, but actually it has to filter down and be operationalized. And that's where we're at right now in England, is trying to get, the strategies down to the day-to-day. I've just finished a focus group for one of the research studies I'm working on at the moment, and great frustrations from doctors and nurses working in hospitals saying, we know about this strategy. Our hospital has a green plan, but we're trying to do things at the bed space, and we're finding that we're being told we can't do that because it's too expensive, or we don't have enough space, or we don't know how to procure low carbon products, etc. So lots of work to be done there, and what an opportunity for nurses to be driving this agenda. One, because there's so many of us, but also as nurses, it's part of our nature, isn't it? To be troubleshooting and being proactive and to be thinking holistically around health. And I think that translates very well into when you look at sort of planetary health. And the pie chart here is data for England, and it's a breakdown of where the NHS England carbon footprint is in terms of when you look at just, what's the carbon footprint of medicines as compared to building energy, for example. So it's not to say building energy is not important, but that's 10%. Look at the blue piece. That's medicines, medical equipment, supply chain. Well, who's using all that stuff? The nurses. So sustainability plans and green plans have quite often sat in estates or been with sustainability managers. And when you're looking at mitigation, it's really important to engage clinicians. And I would say from a bias point of view, particularly nurses, just because, we are one, such a big part of the workforce, but also so influential in terms of ordering supplies, using supplies, waste management, etc. And then there's certain topics that are quite hot topics. For example, meter dose inhalers for like asthma and COPD and like a Ventolin inhaler. So in many countries, it might be that's all you have, the kind of traditional ones with the propellant, and it's the propellant that's got a really, really high greenhouse gas emission impact, and as do anesthetic gases. And there are alternatives. There are low carbon alternatives where we could prescribe differently. So there lots of work going on in those areas, and they're so bad they get their own little 5%. And just to acknowledge, Scotland and Wales also have national strategies, and we're still waiting on Northern Ireland. I asked somebody in a meeting today, is that out yet? And I was told it's work in progress, but it's sort of quite groundbreaking work when you look at the sort of national strategies. And then some of the national themes that have come off the back of the net zero strategy. There's also a very specific procurement. So procurement's all about buying stuff, and the NHS England has made out mandatory national requirements. You can see this roadmap here, requiring industry essentially to green up. And also linking in ethical procurement, because most of the world's healthcare supplies are made under very unethical, very poor labor conditions, including child labor and exploitative practices. So particularly things like gloves, metal instruments, etc. and things. So I know that's not what we're focusing on today, but lots of links between environmental sustainability and social sustainability. If you're going to look at sustainable and mitigation practices for the planet, but that product is still being produced under very unethical conditions, people losing limbs and lives and not going to school, and passports being taken away, all of that type of exploitative practice. Well, that's not sustainable, and that doesn't fit our ethos of nurses and in promoting health either. So that's very much embedded into our supplier roadmap. And then I've also brought in the national clinical waste strategy. A few slides here, conscious of the time, so I'll leave some of these slides to be more of a handout, looking at some goals and key performance indicators around how we can mitigate to reduce our carbon footprint, because waste is such an important topic within healthcare environmental sustainability mitigation. From a research perspective, the National Institute of Health Research in England has also launched new commitments. So that's both about including sustainability as a metric in any clinical research, but also grants. In fact, there's one that opens up tomorrow that are specific for decarbonizing and promoting this mitigation theme within healthcare research. And as I mentioned earlier around quality improvement, we've been using this model for some time now in our education of the nursing course at the University of Brighton, both at undergraduate as well as at postgraduate level. And it works really well for looking at sustainability of not being something extra, but actually being something that we're doing already. And so if you look at education, there's so many aspects of it that are ultimately about improving quality, or people working clinically. I don't know in other countries, but in England, certainly, there's a requirement for people often to be working on a quality improvement project as part of their jobs. So why not just put an environmental sustainability lens on it? And that's what this SFHEA model does, is it sort of takes a traditional quality improvement methodology and says, okay, well, we're improving the goal for whatever the clinical topic is. What about financial sustainability? What about social? What about environmental? If you go to the SFHEA website, all of their resources are free, and you can download templates of doing a SFHEA project. It just opens up that lens to be more encompassing of particularly environmental sustainability, which is the big drive from the Centre for Sustainable Healthcare. And for any students out there, even if you're not doing a QI project, the students that I work with, I quite often get them to think about, whatever essay you're working on, any topic, I guarantee you there is something about planetary health or environmental sustainability that's going to be relevant. And it enhances the reflection, it enhances the critical analysis, and it just helps you to think about whatever nursing topic that you're looking at for that particular assignment. And it just, without adding anything in, it doesn't have to be an extra project, doesn't have to be an extra thing. You take something you're doing already, and equally for educators, it doesn't have to be an extra thing. It's just whatever you're teaching that day, there'll be something about it that links to environmental sustainability. And if you just start small and do one little thing, with time, it ends up growing. And before you know it, you end up having environmental sustainability embedded throughout programs. And certainly organizations like Healthcare Without Harm have been promoting this for some time with nursing school commitments, a nursing climate challenge. And in the UK, it does say for the Medical Schools Council, this was intended for medical schools, but lots of the topics, they're just so multidisciplinary, and a sort of national curriculum they've developed for medical schools that we're also drawing from as well. And any students, I don't know if anybody's involved in Planetary Health report cards. Some of you may have been or may be aware of this already. If not, I'd really encourage, either if you're a student, if you're an academic, or if you're working in areas, whatever your local university or nursing school is, if you could let people know about it. It's a really fantastic initiative. It began with medical students in the States about 5 years ago, I think. And it's kind of spread like wildfire. And there's loads of medical schools that have done it. I think there was 4, maybe 5, I can't remember, nursing schools last year. There's hardly any nursing schools doing it. And I can't understand that. I mean, there's so many nurses out there, so many nursing students. It does take a bit of time to fill out, but what it is the student evaluates their own institution and gives a student perspective on how well the student thinks, or a team of them. It's better if you could do it in a team if possible. Does on planetary health metrics. And so it's broken down into curriculum, research, community outreach, operations, and another one that I can't remember. There's 5 themes. And you can see the picture here. This is 2 students that we had working on the planetary health report card, because we give them a placement time. And again, we didn't add in a sustainability placement. We took a placement that existed already related to improvement and leadership and things. And we just said, well, could you do a sustainability project? And we'll offer the space, and they came into our simulation rooms and did some waste audits and things. And it was just a really fantastic way of allowing the Planetary Health report card to then feed directly back into our curriculum, because in the UK, all universities also have to be showing that they're working on the Sustainable Development Goals. So it was just a nice way of making that link together. And it's not too late to join for this year. You can register now, students, and then I think it's usually due around January, February time, and you submit the report. Or if you miss it this year, you start working on it, submit it next year. It's the process of going about it and asking your teachers and asking around these different domains and how you can improve within the curriculum. Because if we're starting in nursing schools, then hopefully that will translate out into clinical practice as well for environmental sustainability mitigation. So just to wrap up, noticing the time, I really like this model of sustainable clinical practice as well, because it focuses on prevention as the most important thing. And the secondly, patient, and I would argue family empowerment as well. And I think that just another way of saying models of nursing. It's about, what do we do as nurses? We promote health and prevent complications and disease prevention. Because the most sustainable thing we can do as nurses is not to need resources in the first place. And, preventing admissions to hospital, preventing the ICU admissions, my ICU hat on, looking at digital health and apps and self-care and, getting up out of bed and good nutrition and getting outside, all of those types of things, they're not just good for people, they're also good for the planet, because they promote health. Lots of stuff around food and nutrition comes in there as well. And then thirdly, then you start thinking about lean service delivery. Where can we reduce waste? How can we sort of be more environmentally friendly with reusable products and things? And finally, low carbon alternatives. We haven't got that many though. I've given you some examples with inhalers and anesthetics, but the biggest thing we can do as nurses to mitigate and be more planetary health friendly is to really focus on prevention, patient empowerment. And I've given some examples of circular economy principles that are embedded into lean thinking around, ultimately we're going to have to use resources, we're going to have to use gloves, we're going to have to use packs of stuff and dressings and I don't know, depends how you nurse, whatever supplies you're using. Well, what can we keep in the system? You know, where can we reduce, reuse, recycle? You've probably heard of the 3 R's already, and there's other R's around repairing, remanufacturing, repurposing, etc. But if we can prevent something from going in disposal or landfill, then ultimately that's going to save money as well as reduce the carbon footprint. And the local hospital here in Brighton is starting to use ultraviolet sterilization for the first time as well. I don't know if other hospitals are beginning to do that. It's quite new here. And rather than sending equipment off, the one example I had was from an ENT clinic. As an example, they were sending their equipment off to be sterilized using chemicals and steam, or however they're re-cleaning and things. And that requires transport sometimes as well, depending on the equipment. And they found by the ultraviolet decontamination equipment that, yes, it had a financial cost, but actually they can see more patients in a day because it takes 60 seconds and you're not having to go off site. So it's just a small example of how, you know, sometimes a investment in the now can have, you know, longer term financial savings, better for patients, better for the environment. It also meant that the UV light isn't as damaging on equipment. So the life cycle of the actual equipment is a little bit longer because the chemicals and steam obviously is going to have an impact on equipment, which we use a lot of in healthcare. And this was just a diagram from an article I wrote a few years ago, just really exemplifying the themes of what I've talked about today. And when I do my own teaching, I talk about that in relation to the Goldilocks principle. So Goldilocks being the children's book. If you haven't heard of that story before, I think it's quite a common story. And I know it's translated in different languages. You know, not too much and not too little. Because if we don't use enough resources, well, that's no good because, you know, especially in my world of intensive care, that's, you know, we're going to need to use resources. But we do know if you look at the intensive care research, you know, if you give too many IV fluids, too much sedation, too much ventilation, actually you make the patient worse and their mortality is worse. And what we need is that just right, that sweet spot in the middle of not too much and not too little. We err on the side of caution. We do lots of blood tests, lots of chest x-rays, lots of investigations and interventions because we're not quite sure. But we can't afford that anymore financially. We can't afford it environmentally. So we need better ways of that kind of Goldilocks principle being embedded, whether it's intensive care or wherever you work. And just to finish off, because I know we've got to finish off here soon, that these were just some examples of work that I'm aware of going on in my own areas around green teams, reducing unnecessary tests and drugs. One project had looked at cannulas in an emergency department, and they found that 60% of the cannulas, the intravenous, were never used and not needed. But you came into the emergency room, you got a cannula because that's what we do. Right? These sort of traditional habitual practices that we've just continued on, we're actually just taking a moment to stop and think around, you know, do we actually really need it? And I've got some other examples there, but I just want to finish on a case study of gloves. And the Great Ormond Street in London were really looking at, not from an environmental point of view, but they were looking at it from an infection prevention point of view, because there's lots of research that shows when you overuse gloves, infection rates go up because people don't wash their hands properly. And so this came from nurses. It's a fantastic nurse-led project. So it's infection prevention and practice education nurse leads. And they did a big comms piece around communication of, you know, when should you wear gloves? And the intervention was empowering nurses to make their own decision. So they weren't saying never wear gloves. So the gloves off has been a bit misleading. They're sort of, many places are now calling it gloves aware, because of course you need to wear gloves when, you know, you have to. But the intervention of this project was just take a moment, take that half a second, risk assess. You're a nurse, you're a professional, you make the decision. Do you wear gloves or not? And then you follow the policy on when gloves should be worn. And what they found was people didn't use gloves as much as they used to. They saved 21 tons of plastic in a year and 90,000 pounds. I don't know how many nurses you'd get from that 90,000 in other areas, but here you'd get several nurses out of that. So lots of financial savings to be gained. And gloves is one particular topic. If you don't know where to start on mitigation, I would just start with gloves. Lots of research on it. It's better for patients. Infection rates go down. Lots of resources. The Intensive Care Society has a lot of resources that are really applicable to other areas, as does the Royal College of Nursing, etc. And the links have further details about that particular case study. I'm just going to signpost that the rest of the slides have several other links in terms of events. in the UK, a lot of the specialist organizations have got ICU, or sorry, not ICU, got my ICU hat on, like emergency, for example, the Royal College of Psychiatrists, Royal College of Pediatrics and Child Health, etc. They've all got speciality specific sustainability guidance now. Watch this space on ICU, it's about to come. The green surgery one's got a really extensive website. And I'm just going to finish on a thought around, imagine a machine that uses solar energy to remove carbon from the air and turns it into a beautiful, strong, and sustainable building material. Oh, we know what that is. Oh, wait, that's what trees are. Well, let's think about that in terms of people. What about if we imagine a person who can effectively troubleshoot concurrent complex problems while using technical and non-technical skills as a safety critical professional? Well, we know who that is. You can see where I'm going on this. That's us. That's us as nurses. And there's so many of us. There's power in numbers. There's 29 million, that might be nurses and midwives, if I remember the statistic right. And, you know, it's 50% of the workforce is nurses. And so what a great opportunity in gathering today, you know, to build that momentum. And just really encourage everybody to think about what's that one thing you can do tomorrow when you go back to your nursing practice, or when you're a nursing student, what's that one thing you can do on placement or on your essay? Because if we each do one small thing, collectively, that's powerful. If all of us, there's 254 people on the call today. If 254 eco-warriors try to do everything, have some impact, will be pretty minimal. If 29 million of us do one thing, then we can do some really important stuff. Thank you.
Thank you, Dr. Baid. Thank you for that excellent presentation. You gave us a lot of working resources, which we'll have to follow up on. So I really appreciate your presentation. I wanted to just start with a few of the questions that came in. First, I wanted to note that you asked the viewers or the attendees about the IV fluid shortage. And you got, many nurses were commented this in the chat about the shortages and how it affected them, both in the US, and there was a few that commented globally. So I just wanted to know if you could give us some examples of, perhaps in your work environment or others that you're aware of, how that was handled.
Yeah, so I haven't had a chance to look at the chat. I'm can't wait to peruse through. So it's too complicated to look at the chat and
Yes.
the slides. As much as I was saying about troubleshooting and multitasking, we're always spinning plates as nurses, but that's a bit too much for me on Zoom to talk and look at the chat at the same time. So yeah, I'd be really interested to hear about other areas. I know the European Society of Intensive Care Medicine sent out an alert. So it was one of those big, oh, everybody go on alert for IV fluids. And actually, what they were saying was, could everybody please think about it and don't give IV fluids if the patient doesn't need it? Well, planetary health problem or whatever the was in Baxter or not. Shouldn't we be doing that anyways? And so, yeah, so there's been quite strategic policy and maybe not policy, but sort of quite high level communications that's going on. And the International Fluid Academy is running some free webinars, and they have a book, and they're using the term fluid stewardship. So we always use that phrase antimicrobial stewardship, but there's quite a lot of work being done around that area anyways. And yeah, so and hospitals being encouraged to have that concept of fluidship, a little bit like with antimicrobial stewardship. You give the antibiotics if you need it, but only if they need it, and you stop it as soon as possible. So similarly with IV fluids too, in a way, it's not, I don't know if anybody's at rationing levels, might be in the chat, but that, you know, that ethos is what we should be doing on everything in healthcare, that, you know, we can't afford to, not just fluids, and whether there's a crisis or not, we really should be having that ethos and maybe turning these sort of big global events into a positive co-benefit. For example, we'll all now be always thinking about IV fluids, or at least off the back of that recent one, or after the pandemic. Didn't you all have procurement supply problems? I don't know about other people, but until I got into sustainability, I never thought about where stuff came from. I just thought it came from the shelf. I genuinely never thought about who orders it, how does it get there, where does it come from? And then the pandemic hits, and it's like, oh, actually, we can't buy certain products anymore. We can't get enough oxygen. Do you remember all the oxygen shortages? That, you know, so I think lessons learned from the pandemic, actually, as much as there was a lot of damaging stuff around, you know, the PPUs, et cetera, and things on the planet, you know, trying to harness some of the really positive aspects. And people started using a lot more reusables. We can't really do that with IV supplies. There was a Dutch study I saw a couple of years ago where they tried looking at the carbon footprint of glass bottles. and tried doing like sort of old-fashioned times of a glass bottle. But what they found was the carbon footprint was pretty similar. And because the amount of energy that it takes to do the cleaning, and then thinking about storage and space, and it just, it just wasn't practical. But yeah.
And yes, we all have memories of the COVID experience, so that will stay with
Sorry
us.
if that's a trigger for people. That should have come with a warning.
Yes. But
For a group of nurses.
one of the attendees comment, this can sometimes feel overwhelming for nurses in many places that have limited resources to begin with, and even for nurses that live in places where there are access to plenty of resources. Do you have any recommendations on the best place for nurses to start globally if they're wanting to engage their work site in this issue of adaptation and mitigation?
Yeah, I mean, I think that's such an important question, and thank you to whoever asked it, because you can tell I'm really passionate about this stuff, and I've done my PhD in it. I'm in groups like this, Global Nurse Working Group. I'm living and breathing it all the time, and I don't know how other people feel, but it can be a bit gloomy. Like the more you start thinking about all the themes of all of these different sessions leading up until today, it's pretty dark at times. It's a bit sort of pessimistic, and in the political context that's added in, it psychologically it makes you want to retreat from all of it. So I think in my own experience, what I do for my own sort of aspect of that is I try not to worry too much about the things that I've got no control over. And I try to focus on, well, what can I do? What can I do as a nurse? What can I do as a nurse educator? And choosing one thing and doing that at a time and do that well. And I think, picking simple projects, like I gave one example of gloves. Another really hot topic, another pet peeve of mine is, I don't know if you saw the picture of the sharp spins, how many sharp spins where people just chuck all sorts of things in there. And actually that's got a huge financial cost. In England, it's about 10, 11 times more, I think, than normal routes. And so, you could just take one thing and just look at that and make that improvement. And then you do that one more thing, and then you do that one more thing. And then what you find, it's a way of thinking. It's that kind of less is more, Goldilocks principle, stewardship, however you want to articulate. It's a way of thinking around for mitigation around just doing the thing that's only needed for the patient and is the most efficient, effective, and sustainable way from, starting from procurement to use to waste management, etc. Did I answer the question, Karen?
Yeah, I think that's very helpful for the attendees. There was another question from a student midwife on the call, and I believe it just disappeared here, but it was related to the fact that she's working on a project for her thesis on work in the sustainable practices in the delivery room. And her question was, how would you begin to apply this topic of climate change and resources to that particular area of nursing?
Yes, so I have colleagues who are midwives. And actually, somebody I know who was working in adult ICU is now working in an area where I think it's called Born Green is the initiative. It might be a healthcare without harm initiative. Maybe other people know about it. And I know I've saved the references for anytime I ever go and speak to midwives and things. So if you Google Born Green, it might be a work in progress, but that's going on. And they also have healthcare without harm, something about breastfeeding and climate smart feeding or breastfeeding with babies and things. So those might be some things of interest to midwives. In terms of theaters and or delivery rooms. Sorry, I went straight to C-section there. But if it is C-section, then obviously a lot of the implications for green surgery are going to be just as relevant. The other thing that comes up with midwives is nitrous oxide. So laughing gas, is that what other people call it? And it's got a quite significant carbon footprint. And there was a big national project. It started in Scotland, it's kind of spread throughout the UK, where it stemmed from a master's dissertation. And I was at something recently where somebody said that was one of the best master's dissertations they've ever seen in terms of having impact, because it's spread across the whole country now, where it's not a doctor, a pharmacist master's dissertation was looking at the waste of nitrous oxide. Because what they found is when they were doing audits, they were buying a lot of it, but they were only using so much of it in the hospital. So it's not just midwives, but it would be used, in A&E or theaters and other areas, and they were using like less than 5%. So we're buying it and it's leaking 95% of it. So there's a lot of work around nitrous waste in midwifery sustainability projects that I'm aware of as well. If you go to that Centre for Sustainable Healthcare website, they have a women's health network, which is essentially a sort of umbrella that also includes the midwifery sustainability champions in that area, and you might find that there's other resources there.
That sounds very helpful. The next question, there was an attendee that was concerned about the manufacture of medications and that impact on climate change.
Yeah.
So the process of manufacturing, use, and disposal can have a negative impact on the environment. And this attendee wanted to know, what would you say about the first step in beginning to confront that? This was probably globally as well.
Yeah. So I think there's various aspects of that. That sounds a little bit like maybe leaning towards lobbying, and certainly in the UK, that procurement mat, there's similar national pressures on the pharmaceutical industry in terms of smartening up to be more environmentally friendly. Some pharmaceutical companies are more ahead of the game than others, or certain topics, like for example inhalers and things have made great strides in some respects. I suppose from a nursing point of view, we have a voice, and so we can contribute to that pressure on industry, but also making decisions on our day-to-day nursing practice. I have a student at the moment doing a master's project around intravenous, I'm going to say paracetamol, but that's acetaminophen for the rest of the world. So, we use it a lot in hospitals. I don't know what it's like in other areas, but in intensive care, people reach for the IV. It's ordered IV, PRN, and nurses give a lot of intravenous paracetamol. First thing to ask is, do they need it in the first place? So, a whole other topic is, do you treat a fever or not? Because actually that's the natural response. And what's wrong with having a fever 37.9 or, unless it's very high, or, I do that session on the IC course. That's because there are some clinical indications, a bit of a mixed bag in some of the research. But sometimes orders are there just because it's left over, or we're treating numbers, not looking at the patient. So one, do we need it in the first place? There's our prevention. But two, if we are giving it, why can't we crush it and put it down the nasogastric tube? Because we're feeding them, and they might be sedated on the ventilator, but we're giving other medications and food. So why are we giving it intravenous? So I think there's a lot of work that can be done. Like that one project, it's just an example of the student that's looking at IV to oral, even, and then even at oral, the syrup has got a bigger carbon footprint than tablets. Take the tablets, crush them up. It's a bit old-fashioned. A lot of sustainability, just going back to the old-fashioned stuff.
Very good point.
And those of us that remember I'm old enough to remember that things didn't get thrown out. You just cleaned it and reused it, and there was more reusable. So it's going back to that, actually.
It's a very good point, and that may continue in some areas of the world, but definitely should be adopted by others. We have time for just.
Can I just say, though, you need water, though, and in some areas where water supply is hard. So how do you reclean if you haven't got water? What about the chemical implications? You need staff to be able to do it. It's cheaper to buy it and throw it out than it is to pay somebody to reclean it.
Very, very true. We have like 2 minutes, and I wanted to just get one last point, which I think is a good place to end the session today. And Helen Boyd on the call said that you spoke about being the only Bulgarian, the only nurse at the conference this year at the COP. I'm sorry, previously at the previous one. And so how do we as nurses globally begin to engage in policy and be at the table for these decisions? What would be the first step? For instance, what was your first step? Or what can you think of other nurses' first step in terms of getting involved? And we have just about a minute and a half for the answer.
I'll be loud and succinct, and that's the point. We don't have to say a lot, but it needs to be powerful. And Helen's Canadian, and we met in Canada actually through this group, and so she'll advocate on that. The Gobby Canadians, it takes being a Gobby Canadian, and I was only at that Budapest one by default because one of my colleagues couldn't go. But it, and then I thought, have I asked to be at these types of things before as well? So I think it's about asking and being strategic and looking at and using organizations. So our nursing associations and, whatever it is, whether it's pediatrics, for me, it's ICU. Position statements can be very powerful in getting your local organizations to get a position statement out, to get policymakers It's tricky when you haven't got a government that's doing it. In England, we've got a government that's requiring this, but you know, it's where we can, lending a voice to that. And students are a really powerful voice, and maybe that's my bias working in a university, but it's been a thread of my talk today. Engaging.
That's an excellent place to finish. Well, this has been a very excellent session today. Thank you so much for all of your good resources. I think it gives us as nurses a lot to think about. And we wanted to look forward to welcoming everybody for session 10, which is our last session, and that will be on December 3rd. So thanks everyone for attending. Really appreciate your time in the course, and we look forward to seeing you next week.
Thank you very much.
Thank you.